Okay, hello again. Welcome everyone to our webinar titled Fall Prevention and the Social Determinants of Health Across the Lifespan, facilitated by the Fall Prevention Community of Practice. My name is Shamiza Allard and I am the Knowledge Coordinator at the Ontario Neurotrauma Foundation, also known as ONF. ONF sponsors the Fall Prevention Community of Practice, Loop and Loop Junior, along with the annual Fall Prevention Month campaign. So before we begin, like always, I'd like to give you a quick rundown of the Zoom meeting platform. So your screen may look a little bit different depending on the type of computer you're using. If your Zoom application is opened in full screen, you can double click or press the escape button on your keyboard to exit full screen. There should also be a button at the top right corner of your screen that says exit full screen. So on this slide, you can see that I've circled in red where the exit full screen button can be found. The webinar technology consists of two parts, audio and visual. So both audio and visuals are provided through your computer monitor and speakers. So to test or adjust your audio settings, look for the audio settings or join audio button at the bottom left of your screen. This will provide options for testing your computer microphone and speakers. So if you look to the bottom center of your screen now, you will see buttons that will allow you to access the chat box, raise hand, and Q&A features on Zoom. The chat box allows you to send messages to webinar presenters and other webinar participants. You can use the raise hand feature if you want me to connect with you through the chat box. And you can submit questions through the Q&A box. You will only be able to view the questions that you have asked, not necessarily questions posed by other participants. So to simplify things a little bit, for technical questions, please use the chat box. And for topic-related questions, please use the Q&A box. And if you need to leave the webinar at any time, click the red Leave Meeting button at the bottom corner of your screen, right there. So if you have any questions about the technology at any time during the presentation, please type them in the chat box. My colleague Marguerite and I will be monitoring this. Alternatively, you could also email me at shamiza.allard@onf.org. I've included it in the text in the chat box, and I will work with you to resolve any of the technical issues. So the webinar is being recorded, and a YouTube link will be sent to all participants in about 1 week, along with the presentation slides. So I would like to now introduce our presenters, Sandra Newton and Jennifer Russell. So Sandra is the manager of Child Safety Link at the IWK Health Center in Halifax, Nova Scotia. Child Safety Link is an injury prevention program dedicated to reducing the incidence and severity of unintentional injury to children and youth in the Maritimes. Child Safety Link is committed to working with community organizations, governments, and other partners to ensure children are as safe as necessary at home, on the road, and at play. The team does this through capacity building and partnerships, communication and public relations, advocacy and healthy public policy, and research and evaluation. Jennifer is the Executive Director for the Atlantic Collaborative on Injury Prevention, aka ACIP. ACIP is a partnership of government and non-government stakeholders with a common goal of reducing serious and fatal injuries in Atlantic Canada. The key areas of focus for ACIP include policy and advocacy, research and surveillance, sustainability and growth, and networking, partnerships, and knowledge exchange. So without further ado, please take it away, Sandra and Jennifer. You may now share your screen.
Thank you, Shamiza. Thank you very much. So this is Sandra Newton speaking. Good afternoon, everyone, and welcome to our webinar to celebrate Fall Prevention Month. Just getting our slides up here. And thanks again for joining us. We have a welcome and introduction slide, but we're going to skip over that because Shamiza just introduced us. But all of our contact information is at the end of this on the last slide of the webinar. We have a couple questions before we get started. I wanted to ask 3 questions to get a sense of who our audience is today. So Shamiza will bring up the first question. What province and territory are you working in? Okay, thank you very much. Oh, we have quite a few from Ontario, I see. That's great. About a good selection across the province. Sorry, across the country. What sector do you work in? Okay, so we have quite a few from public health, clinical and healthcare, some research, government, and nonprofit. Great, another great variety. And who is your primary target audience that you focus on? And oh, we have a lot of seniors, but we do have a mix of different target audiences as well. This is great. Well, thank you very much for doing those questions. I'm happy to see that there's a variety of stakeholders with us, so welcome everybody. In today's presentation, we will go through the purpose, background and framing context, including efforts by both Child Safety Link and ACIP in fall prevention work. We're going to look at the injury prevention spectrum. We're going to link fall prevention and the social determinants of health. We're going to do the so what slides, conclusions and next steps, and if anyone has any questions. Conclusions and next steps, we will be sending out a follow-up questionnaire that will be addition to the loop questionnaire to all participants with a copy of the slides, because we want to build on some of the challenges and gaps that there may be when focusing on policies, in particular social policy, when it comes to fall prevention. And as mentioned, we will be asking you questions in a survey to help us get a sense of your challenges and get comments around looking beyond individual level interventions. We want to be clear before we continue that we are not experts in social policy, and we recognize that there's an opportunity to leverage some of the existing work out there to help with fall prevention work. This presentation is our observation. And there's also no concrete recommendations. We are bringing awareness to these connections and opening up the dialogue. As promoted, this webinar builds on the report by ACIP released back in May of 2019 called Seniors Fall Prevention and the Social Determinants of Health, a Social Policy Lens. Jen will talk about this report in a few minutes. The webinar is an opportunity to gather stakeholders of fall prevention together to learn, reflect, and take action on the social determinants of health and fall-related injuries across the lifespan. Many individuals and organizations may not realize that they are already addressing the social determinants of health in fall prevention or using a social policy lens in their fall prevention work. The webinar can help surface and share these initiatives with others in the region and provide opportunities for further collaboration and professional support. So the purpose of the webinar is to help participants learn about the links between fall-related injuries and the social and economic conditions, reflect on the social determinants of health links and what these mean to our work. And we have some examples, and we want to demonstrate how we can move forward in addressing fall prevention across the lifespan using a social policy lens. Social policy covers a range of supports, such as programs, benefits, policies, legislation, and other resources that act to protect people through various life changes that can affect their health. These policies function as a social safety net to ensure people are not negatively impacted by these life changes. Examples of social policies in Canada include universal health care, home care programs, social assistance, retirement pensions, and more. So social policy initiatives can reduce injuries by improving social and economic conditions and enabling individuals to increase control over and improve various aspects of their health. So we're going to go into a little bit of background and framing. In terms of fall-related injuries, we realize that most of you already are very aware of the statistics around falls, but for a very quick overview, we know that falls rank high in injury-related deaths, hospitalizations, emergency room visits, permanent partial disabilities, and permanent total disabilities. The most frequent causes of falls are falls on the stairs, falls on the same level, and falls from furniture. And other causes include falls from playgrounds, falls from sport-related activities such as falls from skates and snowboards, and falls from ladders and scaffolding. In terms of children and youth aged 0 to 14 years old, These numbers, the following numbers, come from both the cost of injury report from Parachute 2015, as well as Parachute's The Cost of Injury in Canada Summary Report, Falls and Transport Injury Trends in Children, 2004 to 2010. The link to both of these resources are at the end of this report. So in Canada, falls are the #1 cause of injury hospitalization in children 0 to 14 years old. In 2010, over 7,000 children and youth aged 0 to 14 years were admitted to hospital, and over 150,000, apologize for that typo, visited an emergency department as a result of a fall. Falls in children aged 0 to 14 years cost an estimated $1.2 billion a year. I'm going to pass it over to Jen to talk about the seniors' perspective.
Okay. So in Canada, between 20 and 30% of seniors experience at least one fall every year. Excuse me. Fall-related hospitalizations of those living at home and in residential care are more frequent among women than they are men. And traumatic brain injury, including concussions and related mortality, are significantly higher in older women and men. Now, the next two statistics from 2015 are American. They are not Canadian, but they do give a really full picture around the magnitude of fall-related injuries, both fatal and non-fatal among seniors, as well as the economic costs and impacts of these injuries. In Canada, falls were the major driver of direct costs of injury between 2004 and 2010, and they accounted for roughly $6.6 billion. Now, just to give you an overview of some of the work that the Atlantic Collaborative has done in the area of seniors falls prevention, we've been involved in various projects over the years. We recently hosted the 4th Canadian Fall Prevention Conference in St. John's, Newfoundland, and we continue to participate in the planning of the 5th Canadian Conference this coming June 2020. One of the core components of ACIP's work is to address the social determinants of injury across the lifespan. And in 2011, we produced a report titled The Social Determinants of Injury. This report provided an overview of the social and economic factors that contribute to both intentional and unintentional injuries. It highlighted the importance of primordial prevention, identified those at higher risk for injury, and concluded with recommendations around data collection and prevention activities in the context of social and economic disparities. This report really provided a stepping stone to ACIP's approach in the area of seniors falls prevention and the social determinants of health, and it's a report that we use to really build on the efforts that we'll speak to today. So as Sandra mentioned in her opening, ACIP recently released a report titled Fall Prevention Among Seniors and the Social Determinants of Health, and we looked at this through a social policy lens, the slide here gives you a bit of a background around what the report highlights. Our objective was really to use the existing pieces of work in both social determinants of health and fall prevention to build an introductory information base of the prominent social policy links that are between the social determinants of health and fall prevention, so that current and future interventions can take these links into consideration.
So in terms of Child Safety Link's efforts, Child Safety Link does focus on unintentional injuries to children and youth under the age of 14 years, and fall prevention is one of our priority areas. I've captured some of our key efforts over the last 10 plus years. So in terms of educational resources, we have a backgrounder document called Preventing Young Children's Falls into Home. We have an infographic on child and youth fall prevention that we created to accompany that document. We also have Child Safety Link educational resources on home safety that includes fall prevention, and these are available in English and French. Several years ago, we developed videos on fall prevention, including a resource called the Great Child Safety Challenge, and it was really specific for family resource centers. So they could, those family resource centers could play it for families, and they could look at safety issues by room, and it was a little interactive. And we've also created TV public service announcements on falls and playground falls. Back at the ACIP conference that Jen has spoken about, the Fall Prevention Conference, after that conference, there was the ACIP conference in Newfoundland, and Child Safety Link, along with Parachute and the Saskatchewan Prevention Institute, we led a workshop called Children's Fall Prevention, Reaching for New Heights. And this workshop was really, the goal of it was to discuss fall prevention and get a sense of people's challenges. When we look at research, I wanted to highlight 3 documents produced by Child Safety Link. The first document is actually hot off the press, just released last week. It's called Preventing Serious Injuries in Children and Youth in Atlantic Canada, a guide for decision makers. And the purpose of this resource is to highlight unintentional injury issues for children and youth in Atlantic Canada and provide recommendations for a multi-sectoral, comprehensive approach to evidence-based policy solutions. And the guide organizes actions into the E's of injury prevention, so enforcement, education, and engineering, and by level of government or organization responsibility. And falls is one of the sections in this document. The Decision Maker Guide was developed in response to the next point on the slide, the report Atlantic Canada Child and Youth Unintentional Injury Hospitalizations 10 Years in Review. And several years ago, we also conducted focus groups with families in both urban and rural areas in Nova Scotia to discuss their barriers for families living in low rental housing. In terms of some former initiatives, for many years, we implemented a home safety curriculum with family resource centers across the Maritimes. Essentially, it was a guide to help support family resource centers in discussing home safety issues with their families, and included tools that they could use to help in the conversation. And then several years ago, we had a virtual safety house that users could navigate through a house and highlight and discover various safety concerns and solutions, and that included fall prevention. Now, that resource is no longer available, but just wanted to let you know about that. So for framing, for the webinar today, we wanted to take a policy level approach, and we're not focusing on clinical approaches today. It doesn't mean that they're not important, but the context of this webinar is to focus on higher level policies. We looked at the spectrum of prevention as a way to guide our thinking, and we want to encourage participants to consider the different levels of prevention, and we will demonstrate how these levels can complement each other. So encouraging stakeholders to think beyond individual interventions and encouraging the use of multiple strategies in order to achieve the highest degree of effectiveness. So the next slide is the spectrum of prevention. I'm hoping many of you are familiar with this, this spectrum, but I'll go over it very briefly. The spectrum is comprised of 6 interrelated action levels and was designed to shift the focus beyond individual educational interventions to a multifaceted approach. These are arranged in rough hierarchy, with interventions at the higher level of the spectrum being more efficient in terms of effort per person impacted, and are generally more effective than those lower down the hierarchy. However, the levels are interrelated, and those interventions most likely to succeed will be those that address multi-levels of the spectrum. If we start at the bottom and move our way up, the spectrum consists of 1, strengthening individual knowledge and skills, 2, promoting community education, 3, educating providers, 4, fostering coalitions and networks, 5, changing organizational practices, and 6, influencing policy and legislation. Activities at each of these levels have the potential to support each other and promote overall community health and safety. The spectrum of prevention is a tool which can help practitioners and policy leaders move beyond primarily educational approach to achieve broad community goals through injury prevention strategies that include policy development. As said, the spectrum is a tool that encourages prevention practitioners to think beyond individual education. So in the next slide, we provided some examples of the spectrum level using falls prevention. We will be focusing mostly on policy and legislation level, and we will explain how these levels interact with each other's level. So if we look at strengthening individual knowledge, we have a program teaching individuals exercise movement to increase balance. We've moved up to promoting community education, and that could be a public awareness campaign. Educating providers could be the Canadian Fall Prevention Curriculum. Fostering coalitions and networks would be the Loop, just what we're on today, and Loop Junior. Changing organizational practices could be long-term care facility implementing a safety practice. And then influencing policy and legislation could be adopting safe housing legislation. If you're interested in learning more about the spectrum of prevention, it is outlined in a resource called the Canadian Injury Prevention Resource, and we do link this resource at the end of the presentation. I'm going to pass it over to Jen.
Okay, so now we're going to move into linking fall prevention and the social determinants of health. Again, keeping that spectrum of prevention in mind as we go through the next half of the webinar here. So I hope many of you have heard of the social determinants of health and how they relate to injury. So we're just going to go through a bit of a reminder and why this is important. And that's because the burden of injury is not equally shared amongst the population. So the primary factors that shape our health, including our ability to prevent injuries, are not lifestyle choices or medical treatments, but rather the conditions in which we live, work, and play. Our health is shaped by how income and wealth is distributed, by the health and social services we receive, and our ability to obtain quality food, education, and housing, among many other factors at play. This is just a list of the social determinants of health that we refer to, and this is just from the Public Health Agency's list. So we wanted to give an example of the interactions between the social determinants of health and fall prevention using one of the social determinants, and that being income. So if we look at income and we kind of follow this flow of this flow chart, you'll see that income can actually impact working conditions. So low income can lead to poor working conditions, or high income can lead to greater, more positive working conditions. Low or high income can impact whether or not living conditions are safe, have adequate lighting, have adequate safety measures in place, as well as the type of environment in which someone lives or socializes. Here we have play environment, which is an example for children. And as mentioned, the income can affect these levels of conditions, which can either lead to negative or positive exposures. And what we've showed here is that low income can lead to negative exposures, which then increases the risk for injuries such as a fall-related injury. So this brings us to how can we sort of piece this all together? How can we prevent fall-related injuries in the context of the social determinants of health, the so what factor, excuse me, to our presentation? And as mentioned several times through the webinar so far, we've taken a social policy approach, and we've really looked at this from an injury prevention policy. So social policy is actually injury prevention policy. This is how we're looking at it. So by improving those daily living conditions and those conditions in which we work and play, we can reduce the rates of injury, including fall-related injuries. Again, just to give you a reminder of how we're defining social policy in the context of this, social policy is a range of benefits, programs, and supports that protect citizens through various life changes that can affect their health. It functions as a social safety net to ensure that people are not negatively impacted by these life changes, and considers the roles of various sectors, society, governments, communities, and individuals in providing these supports and services across the lifespan. So some examples, again, may include childcare, employment insurance, health and social services, social assistant, home care services, as well as retirement pensions. There are probably many more that we're not listing here, but this just gives you a snapshot of those that we've included. So again, how does this all fit together? So looking at this flow chart, similar to the social determinants one, if we look at social policies and move our way down, some examples being tax credits or social assistance, especially important to those vulnerable populations such as children and seniors. Those supports are in place to then help decrease injuries. So whether that tax credit helps for home repairs for a senior, which means they're less likely to have a negative housing situation or negative environmental exposure, thereby reducing their likelihood of a serious fall and then contributing overall to improved health. And what does this mean for injury prevention and fall prevention? Well, adequate investment into social policies would reduce injuries and other health issues in Canada. And what we're really trying to show here is that it's an important component of a comprehensive approach to preventing fall-related injuries. We have an opportunity to really leverage some of the existing work and existing social policies out there in our provinces and other jurisdictions that can help us in our fall prevention work. And we're going to get more into that right now. So in the ACIP report that we released in 2019, again, there will be a link at the end of this slide deck. We provided social policy examples by each Atlantic province that could support fall prevention efforts. And many of these examples are seen commonly in all 4 Atlantic provinces, and I'm sure there are similar ones in other jurisdictions across Canada. It might just be titled somewhat differently. So we want to bring back again that spectrum of prevention piece. We've chosen to focus on this particular part of the puzzle to a comprehensive approach. And although a social policy may help provide an income incentive or another social support, it is important that the other pieces of work are part of this approach. So just because you provide someone with an income incentive, they may also need the education component to understand the seriousness of falls, to understand how that home repair could prevent their fall. So this is showing how all of this works together and leverages and supports one another for a more comprehensive approach. So in that report, we actually created charts, again, that outline social policy examples by each Atlantic province. We've outlined what sectors were involved to show how important it is to work with other agencies and government departments, and then highlighted some high-level links to the social determinants of health and fall prevention. Again, these are just some high-level examples, and we'll go through both some for children and youth as well as some for seniors.
I'll go through the child and youth social policy and fall prevention sort of charts that we put together. And again, this is very brief and high level. The first example would be the provincial child benefit. And in Nova Scotia, that would be from the partner would be the Department of Community Services. In New Brunswick, we understand it's from Finance and Treasury Board. And in Newfoundland, it's the Department of Advanced Education, Skills and Labor. So this benefit is a tax-free amount paid monthly to help low and modest income families with the cost of raising children under the age of 18 years of age. And these amounts are combined with the Canadian child benefit into a single monthly payment. So for example, you get about $52 per month for the first child, about $68 per month for the second child, and $75 per month for each additional child. And the links to social determinants of health and fall prevention could be financial assistance to lower income families with children. This could be used towards safety equipment such as baby gates. Another example would be Healthy Beginnings, also known as Enhanced Home Visiting or Best Start. And this provides additional support to families facing challenges through a comprehensive home visiting program. Families may receive home visiting support for up to 3 years and/or referral and linkage to other health and community resources. Home visiting focuses on supporting parents, promoting a healthy parent-child relationship, fostering healthy childhood development, and linking families with community resources that further enhance the opportunities for healthy growth and development of child and family. So partners, again, it could be health PEI, public health nursing in PEI, and the Department of Health and Wellness. And the link would be providing an opportunity to identify hazards in the home and educate parents about preventing falls. And Jen's going to talk about a couple seniors examples.
So the one I've chosen to highlight is the Home First strategy out of New Brunswick. And the Home First strategy is a series of approaches and initiatives based on a model of shared responsibility and sustainability to support seniors to live in their own homes and to continue being a part of their communities. It represents a shift away from nursing home care toward a greater focus on healthy active aging and on home and community-based care integrated across sectors and services. So this initiative involves the Department of Social Development and the Department of Health in New Brunswick. And to demonstrate the links, it does support seniors to stay in their home longer and promote active living. Being a part of their community means there's some social connectedness, there's less likely to have some social isolation, there's access to home-based medical equipment, and access to community-based allied health professional teams. Again, those being community-based, so the transportation barriers or challenges that that a senior may face in getting from their home to a health facility outside of their community. This helps mitigate some of those challenges. And just for the sake of time, I won't go through these other examples in more detail, but I did include a financial assistance example, as well as the role of the caseworkers role in the Department of Community Services in Nova Scotia. Again, these are highlighted in the report in more detail. It gives an overview of each policy example, and then the links and sectors that we've highlighted here.
Okay. Social policy initiatives, as we've said many times in this webinar, social policy initiatives can reduce injuries by improving social and economic conditions and enabling individuals to increase control over and improve various aspects of their health. As Atlantic Canada's aging population continues to increase, fall prevention will continue to be an important public health issue. As well, we want to protect our children so they can thrive to be productive, healthy adults. We've identified common and significant links between the social determinants of health and fall prevention across the lifespan and specific social policy examples that can leverage fall prevention work. We hope this information encourages the continued and future collaboration of stakeholders across a variety of sectors and settings to develop and advocate for social policies that are responsive to fall prevention. So in conclusion, there are many opportunities for stakeholders to participate in different aspects of social policy. And the following slides, we put together some slides to provide examples of opportunities and roles in social policy by stakeholder. So again, you will have these slides to read and review, but I'm going to go through one or two of these quickly so you can get a sense of the types of examples we provided. As one example, we looked at family resource centers and public health, and they're wonderful partners in injury prevention and do a lot of injury prevention work in their own communities. And to help demonstrate the different roles different sectors can take on, we've outlined a few examples. So family resource centers and frontline public health staff, such as nurses, home care workers, community facilitators. Some things that they may want to think about, or we should all think about, is translate understanding of individual and family issues into suggestions for policy change at a population level. Develop and maintain meaningful community partnerships and networks to increase collaboration and understanding of community issues. And so, for example, here at Child Safety Link, we do have several family resource centers who sit on our advisory council, and there are a tremendous amount of information that we get from them. Another example would be using social media platforms to draw attention to the important links between fall prevention and the social determinants of health, as well as to directly communicate with key audiences on social policy opportunities. So, for example, the tax credit and other benefits available to these key audiences. Another example could be managers or injury prevention specialists. Some of the work they could do is identify local issues with public health policy solutions through practice and community partners, provide content and process expertise to advocacy actions, facilitate dialogue within your own organization to support policy action, develop, initiate, and contribute to background documents, including position statements where applicable, to increase understanding and awareness within increasing understanding and awareness, share expertise and evidence on fall prevention and the social determinants of health through government, stakeholder engagement activities, and identify trends and interpret epidemiological data on issues. I think what I'm going to do is just going to leave these other ones, but we've tried to outline some examples through directors and executive members and physicians and researchers and non-governmental organizations. So obviously there's going to be more out there, but these are some examples just to help us demonstrate the variety of roles and what is possible. I'm going to hand it over to Jen.
All right, so we're bringing this slide back again, framing all of this in the context of the injury or the prevention spectrum. So we just wanted to bring this back for a quick review to help everyone, again, continue to think about their possible roles and where their actions fall within this spectrum prevention and how that contributes to fall prevention and the opportunities that are for any future work in collaboration in preventing falls. Addressing the social determinants of health as they relate to fall prevention is a shared responsibility, and that includes collaborative policies, programs, training practices, and an integration with other sectors such as health, community services, social development, finance, as well as other agencies such as nonprofit organizations, non-government organizations, community care settings, and seniors and families themselves. So we will have a follow-up survey that is going to give us a little bit more information and feedback from you as stakeholders in fall prevention to help us work through more of this, the opportunities there are, including what types of challenges or barriers there may be to using or addressing social policy, using a social policy lens to address social determinants of health. What you think are some possible solutions to help us overcome this. And we'll be using this information to, again, move our work forward and hopefully have an opportunity to come back and share with you at the National Fall Prevention Conference. I will say that this survey will be different than the survey that Loop will be sending, as Loop does a survey as an evaluation of the webinar itself. But we'll be sending the survey as a follow-up to inform some of the next steps in our work together. As mentioned, these are several resources that we've used both in our work as well as those that we've highlighted in the webinar today. So the Canadian Injury Prevention Resource developed by Parachute, the ACIP reports, Social Determinants of Injury, and the Seniors Falls Prevention one. And Child Safety Link reports the Decision Maker Guide and the infographic as well. And then we've highlighted just some general websites where you can access fall prevention information, and those that we've looked to certainly in the work that we're doing. And then with that, I think we have opportunity for questions. I think we ended a little early. I was scared that we were going to end late, so I skipped over a few slides. But yeah, we'll bring up the Q&A box here.
Okay, so thank you very much, both Sandra and Jennifer, for a really wonderful presentation and for really sharing your extensive knowledge on the topic of fall prevention and the social determinants of health. So as you mentioned, we do have a few participants who submitted their questions in the Q&A box. So you guys can kind of run through them now as you see fit. And participants, if you have any other questions, please send them Jennifer and Sandra's way.
So we have one that says, do you think there is a risk of framing individual education interventions as social policy as described in the home visiting example, as this focuses on individual knowledge development? I don't believe we highlighted that as a social policy piece, but more so as a level of the spectrum that would definitely need to be part of a comprehensive approach. Certainly social policies can be part of the whole picture, but education is still needed for the individual knowledge development. So providing someone with a financial benefit is great, but there still needs to be an environment that supports that benefit, as well as the education on where to find that benefit and why it's important. So I hope that answers your question.
Yes, we did say home visit. We did use home visiting as an example, but again, like Jen said, I think it's around collecting information about not only those individual information you might provide the family that you see home hazards in the home, but educating them, but also bringing that up to maybe other levels that might be able to look at other possible solutions using a policy lens. And what those would be, I'm not sure. I mean, I think that's sort of part of the conversation. Yeah. Okay.
And then the other one says, I wouldn't say we have an issue. We have excellent plans to ensure access to transportation with our aging population. From my end, I would work to educate seniors of these services available. Certainly, yeah, I think that was just an example of some of the challenges that may or may not exist. And certainly if it's not happening within your jurisdiction or area of work, that's great. But that was just a sort of a high level example of something it could address should that be in place. Are there any other, that was it for the Q&A box, but are there any other questions or comments?
There's also some additional ones in the answered box that Marguerite and I were kind of going through, if you guys want to read those out. Or let me know and I can read them, whatever works.
Oh, we got them. Okay, so when those social policies were created, was there a specific aim to reduce falls, and are falls outcomes being tracked? From our understanding, that was not the aim of these social policies. These served as, from their departments, as a goal within their department, falls not being part of that. And I don't believe fall outcomes are being tracked. That would be an awesome evaluation project. Certainly would love to talk to anyone about that for those in research and academia on the webinar. I think that would be a really good addition to this work. So thanks for asking that question.
Yeah, and I think we use that example of what are some roles of researchers, and that would be added to that list.
So we have someone asking where on the spectrum would this fall? And I'm not quite sure if they mean social policy itself or our work with the webinar. So policy itself, it would probably fall within all of those levels or touch on all those levels at some point. Some of them would be at the top level for policy and legislation, but as we mentioned with the home visits, that would really touch on a policy piece, but also on strengthening individual knowledge and skills.
And I think for me, I don't want to I think the spectrum's a really good tool to use, and it's a really good model to use. And I also think it's just a way of making sure we don't stick to one level. And it demonstrates the importance of taking that multi-sectoral approach. And I mentioned like the ease of injury prevention. So the more ease, the better. So I think the more levels, the better. So I don't get so, like, I guess me personally, not so hung up on what level you're going to slot your initiative into. But I think the take home is around trying to use a comprehensive approach.
We answered those. There's one. I work in recreation and community facilities, and we want our public to access our therapeutic programs. So public transit and trans help is part of the puzzle, not just the accessibility within our buildings. Yes, that's very important.
Yeah,
I think that was more of a comment than it was a question, but certainly, yeah. When we answered these other two here. Would there need to be different indicators identified to track falls as a result of social policies? If so, would you have examples of such indicators? It's a tough question. I don't know what current indicators are being used to track the social policies as they are currently within our within the department or sector that houses them. We didn't really go that far into detail. We certainly just wanted to bring awareness to, just bring general awareness to those that are out there to help show how we could be looking to social policies to help support our work. Certainly something we can follow up on and see what the indicators are and what some examples would be.
Yeah, and I think what we would, I mean, that's a great question. And so I think that would be something we would put in some of those, what Jen mentioned that we want to collect after the fact is people's barriers and sort of concerns around looking at social policy. And I think one of those barriers is that perhaps we don't have the indicators to and measure things as we should. And so we could put that down as one of the barriers and see what a next step might be around that.
Also, I just want to highlight that's a good collaboration opportunity because for those sectors who, like I said, where these policies may be housed, I'll say, so for example, some of the tax credits may be housed in a finance department. It's an opportunity to then collaborate with that sector, and maybe the indicators that we have may or may not be helpful as well to the work that they're doing, and an opportunity to provide a different picture to the work that they're doing. Different ones.
So there's one more question that I saw in the chat box. So poor oral care is a big factor in nutrition and good health. How would you recommend practitioners work across Canada to help make this happen?
I don't think we can speak to oral care. Can you read that again? Sorry, it's hard not to.
Sure. Poor oral care is a big factor in nutrition and good health. How would you recommend practitioners work across Canada to help make this happen?
Well, as Jen
mentioned, you can answer.
I don't think we can answer that, but I mean, I think with injury prevention, as Jen just mentioned, collaboration is key. And so determining what nationwide organizations are out there that you might be able to start the conversation. And so with injury prevention, there's something called the Canadian Collaborative on Injury Prevention, and those are representatives from each province who talk a lot about sharing and issues that they might see in their own provinces. And through that group, we are able to reach, do different work in the provinces and perhaps look at more national focused work. So in terms of the oral care, I don't know who those groups would be, but it's the same sort of, you can still use the spectrum as a way of a model in terms of doing work. I hope that answers the question.
So we have another question here around whether if it's standard practice to include an evaluation plan when implementing fall prevention programs policies, and if not, why do you think that is the case? I don't know if there are standard evaluation or standard practices to include evaluations in certain programs or policies. I can't speak to to all of them. I think certainly the social policies that we've highlighted as part of this presentation, as we mentioned, they're not, as far as we know, they're not evaluated based on their fall-related injury outcomes. And that was one thing we think would be a great evaluation project to determine what indicators are currently being used to determine whether or not that is a successful policy, and what indicators might be missing. I think evaluation in general is sometimes missed because often costs a lot of money to do comprehensive evaluation. I think folks, if you don't build it into your current practice, then it can be hard to do so at the end. It's good to try and build it in at the beginning, I think, when you're developing, whether it be a policy or program right off the bat. But that's just a general, I think, health promotion question answer. I don't know if that's specific to falls. Any other? I think we got them all in the chat or in the Q&A box, but.
So thanks everyone. As mentioned, this was just a very introductory, high-level introduction to start thinking about social policies and the link to fall prevention. As mentioned, we're not the experts, and I think it was really interesting, those questions we got, and we'll sort of take that back, as Jen said, and think about some next steps. We really encourage you to fill out the survey that we will be sending, because that will also help us see sort of the barriers that people are having, if any, and any solutions, and just to see what's out there. But I think this was a great first step, and I want to thank you all for joining us today.
Great. So thank you again for your great presentation, and participants, thank you for attending. We always appreciate having a good group of people listen to these wonderful presentations. So for more information about the Fall Prevention Community of Practice, please visit fallsloop.com. As a reminder, November is Fall Prevention Month, and we all have a role to play. So please visit our website for ideas on how you can take action in addition to promoting Fall Prevention Month in your community. So you can go to www.fallpreventionmonth.ca. So when the webinar has ended, you'll be redirected to Zoom and you'll be invited to participate in a short survey. Again, this is different from the survey that Jen and Sandra are referring to. So this is to evaluate the overall webinar. So please click the blue continue button on your browser and you'll be redirected to a brief evaluation survey. And we'd appreciate if you could provide feedback so that we can continue to offer high quality webinars in the future. So thank you all and have a wonderful day. We'll see you next time. Thanks everybody.
Thank you.